Hello everyone, my name is Nonita. I am PhD in biophysics. Basically, my research work is focused on the synthesis of the biomaterial for the bone regeneration. And today, my topic is on the osteoarthritis. What is osteoarthritis? What are the problems? Which age group people are more vulnerable for this? And what are the treatments that are we going to discuss about. So I'm going to share my slide and so we can see what is osteoarthritis. Here we are going to discuss what is osteoarthritis. It is a common musculoskeletal disorder which we can see in the older population that is above 45 years of the age. The most common form of arthritis is the it causes pain, disability, reduced workability, and deteriorated quality of life. Here we can see that it is a normal joint and this is osteoarthritic joint. Here we can see the wear and tear of the joints with the age as due to the mechanical stress of the body increases and that increases the wear and tear of between the joint and led to the deterioration of the joint. So there is no to the date there is no comprehensive treatment for this osteoarthritis and it causes so much unbearable pain when osteoarthritis develop in it can develop in knees, shoulder, hands, hips. Now we can discuss about the what are the causes. Main cause obesity. Increased body weight led to the mechanical stress on the body joint and led to the wear and tear of the joints. The, the body mass index required is 18.5 to 24.9. First, what is the body mass index? It is the value obtained from the body weight and the height. The normal body mass index is this and overweight lies above 25.5 to 29 and obesity lies above 30. This body mass index is more vulnerable to the osteoarthritis. Another thing that cause this disease that is occupation and physical activity. It is due to the sedentary lifestyle, long hours sitting, kneeling and led to the osteoarthritis. Another factor is age. The most prominent people are the to this disease are the vulnerable that are vulnerable to this disease are the elderly population that are old people. Another factor contributing it is chikungunya virus that is caused by the arbovirus transmitted by the Aedes mosquito and similar infection like the dengue like syndrome with the intense joint pain. After post chikungunya virus, the people developed the joint disorders that is commonly associated with wrist, elbows, fingers, knees, and ankles. Another factor is the joint injuries. The people who has met with any accident, any uh, due to the playing sport or any accident, develop this disease. And now it is also dependent on the gender also. The women's are more vulnerable than men. This is due to the women's above the age of 50 to 60, 80% develop the hand osteoarthritis as compared to men, 40% knee, and 10% hip osteoarthritis than men. What are the reason first is hormone levels. The Due to the menstruation, which led to the joint loosening and stretching, and led to the instability and further loosening of joints. Menopause. During the menopause, the estrogen deficiency take place, which decrease the bone mineral density and led to the accelerate the osteoarthritis process. Another factor is the muscular skeletal difference between men and the women. Women's experience more wear and tear of the joint, as women knee joints do not fit together or move with each other, so as they contain less cartilage as compared to men knees. Another is the lower quadricep power. What is quadriceps? This is, I mentioned with the arrow, that is quadriceps. This part is indicated by quadriceps. Due to low cartilage in the women, this led to the decrease in quadricep power as compared to the men. Another is pain sensitivity. Women are feel sensitive to the more heat, cold, and mechanical pressure. So, as greater mechanical pain sensitivity of the deep tissue in women when compared to the men. And the last and the most important, obesity prevalence. Women are more prone to obesity than the men, well, which led to the damaging of their bones and joints due to the friction and led to the osteoarthritis. Treatments. Many treatments are there, but there is no permanent treatment for this disease. There is a temporary relief from this problem, as by taking the allopathic medicines to relieve the pain, that is non-steroidal anti-inflammatory drugs. Ayurvedic osteolupan is the unique blend of well-researched herbs. It is an antioxidant which facilitates the removal of free radicals in the body that cause damage to the body structures, including joints, cartilage, and tendons. Another is the rose hip powder, which can inhibit the leukocytes function that cause cell injury in the osteoarthritis. Natural treatment. Intake of vitamin D. Vitamin D is associated with the articular cartilage and bone metabolism. And the people with the low to moderate level of vitamin D, that is 3 to 347 international units per dose, were at an increased risk of hip and knee osteoarthritis. As due to the deficiency of vitamin D in the body, the parathyroid gland secrete the serum that deplete the calcium from the bones and reduce the bone remodeling, that is replacement of mature bone with the new bone. So it is recommended to take the vitamin D in the form of, rich source of vitamin D are the milk products, cheese, yogurt, and eggs, and sunlight. Most important, sunlight. Another is the weight loss. The people who are more elderly age are more vulnerable to this disease. So weight balance should be maintained, as arthritis is totally dependent on the dose dependent relationship between the obesity and osteoarthritis. The reduction of weight by 5 kgs decrease the chances of development of osteoarthritis by 50%. Another is the diet and exercise. Proper diet and good leafy green vegetables and exercise led to mobility of the joints and decrease the pain as well as the chances of developing this osteoarthritis. And last one is the sleep. Good sleep. Good sleep is required, which as due to the sleep disturbance cause a depression and led to the joint degradation. So a good sleep is required to prevent this osteoarthritis. So these are the natural way of treatment to prevent the osteoarthritis or ease the pain of osteoarthritis. So thank you guys for watching my channel. Please subscribe and share. Thank you.